Customers are counting down the days until Moorhead's medical marijuana dispensary opens. Early feedback from Minnesotans who are already prescribed says that it works when they can afford to get it. Good evening and thanks for joining us. Moorhead's Medical Cannabis Clinic is set to open on June 18th. It's one of only 8 locations in the state where patients can get the drug.
New survey results are back from the Minnesota Department of Health, and they say 90% of the patients currently in the program report mild to significant benefits. However, 73% of the patients say the cost is not affordable.
Valley News Team's Ashley Bishop tells us what big change is coming to the program and how that may change the cost for patients. Ashley?
Mike, Andrea, the 107-page survey includes feedback from patients and doctors. About 20% of those responded said the cost was the most harmful aspect. We had the opportunity to speak with the CEO of Minnesota Medical Solutions about the cost and what is being done to make it more affordable. One patient taking medical marijuana for cancer says the cost is high, and month to month, I do not know if I will be able to afford a monthly supply.
What people are comparing it to is, the $7 copay that they have at the pharmacy to buy a bottle of an opiate like Percocet. And there's no way without insurance coverage that we can compete with those prices.
Kyle Kingsley is a doctor and CEO of Minnesota Medical Solutions. It's one of the 2 statewide providers that grow marijuana and refine it into pills and liquids. He says prices average about $250 a month for patients, but can go as high as $1,000 a month.
It depends on the patient's condition and the exact medication that they need.
Discounts are given to those on Medicare. The Department of Health says they don't set prices for medical marijuana and that no insurance company in Minnesota covers the treatment.
And then what we're doing is federally illegal every day. And that's something that insurance companies aren't going to they're not going to develop a policy on something that's federally illegal until we see some substantial changes.
Kingsley admits medical marijuana does not work for everybody, but come August, the program can take on more patients. Those suffering from severe pain could qualify.
As more and more patients enroll in the program, we anticipate there'll be better economies of scale that'll help bring prices down. But, for some people, when the alternative is a $7 copay, it's never going to be financially feasible for them.
It's important to note that this survey was voluntary and just taken 3 months into the program. Nearly 250 people and 94 doctors responded. As of today, the Department of Health website says there are more than 1,400 patients and nearly 600 doctors enrolled in Minnesota's registry. The number of both patients and doctors have doubled since the survey was given. Andrea?
Thank you, Ashley. In the survey, 12 patients say they were able to reduce their pain medication dosage when taking marijuana. 6 people specifically mentioned a decrease of opioid use.